and this will be Dr. Zev Leifer from the US. And well, Dr. Leifer, please deliver your speech.
Thank you. Thank you.
So the audio is well.
All right, first of all, let me welcome everybody. Good morning, good afternoon, or good evening, depending on where you are. This presentation is entitled Low Budget Strategies for Digital Pathology Education, designed for low budget parts of the world. The overall theme will be medical education. The strategy will be to essentially do things that many high-powered capabilities costing a lot of money are needed to accomplish. And I've got some ideas as to how you can do that for a low budget, depending on where you are, and as we will discuss how it can be applied. By way of declaration, I have no conflicts of interest with any of the commercial products referenced herein. This program is divided into 5 projects, different ideas, different strategies. Project number 1 is digital pathology in the medical school pathology lab.
Excuse me, we cannot see your presentation. Have you already shared your screen?
I have, well, we'll find out in a second. Sorry about that. The audio is coming through?
It's perfect and clear.
Yeah, but is it, well, the audio is good.
Yeah, we see you on the screen in front of your computer, and we hear you very well, but
Okay.
we cannot see your presentation.
Okay.
This looks very well.
Okay.
Yes, perfect. Thank you.
All right, you have audio, you have video. We're good. So this is what you heard me say. This is the first project we are beginning. This is the New York College of Podiatric Medicine, where I taught for 37 years. We had a pathology laboratory course. We covered basic pathology as well as systemic pathology. The 16-week course, during that time, we covered approximately 105 slides. I would begin the lab by introducing the slides we were going to look at for the day, essential features to find. They would do their work for the bulk of the time in groups of 4 students. And at the end, we would have a conference, put up some new slides, unidentified slides. What are you looking at? What's your evidence? Back and forth with the class until we reached a conclusion. For 30 years, I did this with microscopes and glass slides. Then the world changed over to virtual microscopy, to digital pathology. The Olympus company digitized our slide collection, provided viewer software. We had Wi-Fi capabilities in the lab, and the students used their laptops of various sorts, and iPad mini with appropriate viewers. What this meant in terms of medical education and in terms of comparison with the world up until that point is that, first of all, as an advantage, all the students have the same slide per class, per section, per year. In other words, previously we worked with a box of slides, commercial slides. Not every slide was identical. It was the same pathology, it came from the same company, but the cut was different. And if I would want to make a didactic point and say, look at that structure at the top right of the slide, well, not everybody had it at the top right, the same structure, but it was a different slide. It was somewhere else. So now we have one single slide for everybody, digitally available for everybody. So that was a plus from an educational point of view. Being digital, they can study at home. They can log on to the website. Being digital, we have all sorts of advantages. You can split the screen and look at normal slide versus pathologies side by side. With the internet, you can access slides from other collections. So moving from microscope to computer has changed the capabilities for education. I want to focus on looking at the slides and working with the slides, right, for the right price, meaning a lot of money. You can get high-end scanners and viewers, certainly at an industrial scale, meaning hospital or commercial labs. Dr. Darren Trainer was telling me he's got 60 pathologists on staff. Dr. Leon Pantanowitz mentioned at a meeting that he'll see about 1 million slides per year. So you need high-class materials. Focusing on annotating and manipulating the slides. On the other hand, for teaching in a classroom, given that, as I said, you have a digitized slide collection, a laptop viewer, that's the beginning of the story. Now the question is, what can be done with what is at hand? First of all, slide capture. And what this shows, and I'm going to go through this format in multiple slides, whether using PC or Windows system, whether using a Mac, Apple system, there are various simple commands, either built in or an app that you can easily download to save the image. You can edit it. The PC uses a paint program, the Mac uses a preview program. iPad, you can have or download Notability. So crop the image, rotate the image. Most importantly, annotation. You can annotate, you can edit, meaning you can cut and paste selected areas, realizing that much of the slide may be normal tissue. You want to find the area of pathology. And when you find it, with these simple, inexpensive strategies, you can circle the area, you can underline it, you can label it, you can put in arrows, and make a much improved and more advantageous final product. For example, here's a slide of gastric ulcer. Here, this is a student product. This is what students did. This tissue sample was a tissue sample. That was the slide. They circled it. They put arrows in. They put a label in. This is granulation tissue. This is no mucosal overhang with various features that were discussed that were relevant, diagnostically significant. Might I add, likely to show up on testing in an academic environment. So this is a greatly improved presentation. For those who are particular and experienced, this slide is upside down. This is mucosal surface. This is the ulcerated area going downwards, which in this slide is upwards, just to orient you. Same thing for a chronic ulcer. Here is the box the students put in. Here is fibrous tissue. Here's an arrow. Here's a label. So you have an improved product. Continuing in this theme, very important area is slide presentation. You can save it, copy it to a Word document. You can take this image and put it into a PowerPoint presentation. And then we come to slide sharing. You can email these documents, email the PowerPoint, store it on Google Drive, or store it on a wiki and make the larger audience have access to what you have produced. I mentioned some of these, slide sharing, just in anticipation. The buzzword at the professional level is telepathology, and we have at the undergraduate level training conceptually and perhaps in some techniques for that world of the future. So that was project 1. Project 2 follows from this. For those that are not familiar, we were developing the use of a wiki. What is a wiki? To start with, think of Wikipedia. I think most people are familiar with that. What a wiki means functionally is that you have a website that all, meaning multiple people, have access to it. So it's not, most of the websites are finished products put up and you can watch, but you can't modify it. Here, everybody can submit. Not only that, but they can edit in various ways, add to it, delete it, comment on it. So you have a tremendous amount of control. Secondly, and this is the point of my talk, you have public platforms. WikiFoundry is one, Wikispace is another. You have the links here. So they provide the format, the background, the platform, and you have complete control of the content. So for my class, I put together such a wiki. This is my introduction and so on. And this is a way to access particular pages. I'll call your attention to photos. And when you click on that, you get to a collection of, all right, these are slides. These are fixed images. The total collection over the course of the semester. But these are what I call value-added photos, as we just discussed, circled, underlined, arrows, etc. And these, in turn, are organized then by the students into albums. So you have all the different slides in the area of bone and muscle, all the different slides in the GI pathology, all the distinct slides in male and female genetic system, genital system. We have environmental pathologies and skin pathologies and so on. Some comments from the students as to the product. On the positive side, they liked the ease of use. Very interesting comment on sharing of best slides, right? If you have even a single slide presented to them, but their job as students is to scan the slide top to bottom, right to left, find the most representative area. Not everybody will have the same opinion as to what is the best area. And then following through on what we said earlier, circling and labeling and so on. The final product will vary between students, and they put them all up on the wiki, and you can pick out the best one out of a number of options, and or multiple images of the same pathology, different parts of that same slide, so you get a better picture. Aids in exam preparation, as I mentioned. Certainly helpful if you have a student in the group who just couldn't find the pathology. You spent the class time or time at home, didn't know it well enough, didn't find it. So now you have it here, and here's the pathology. Access out of class, easy to share images, as we have mentioned. There were some weaknesses that were commented on as well. Certain technical issues, what happens when the website is down, slow when there are too many users looking at the same website, especially before exams. For some cases, depending on how tech savvy they were, the learning curve, how to upload. There was a problem with student errors, meaning you need more proofreading, meaning sometimes it's a question of typos, sometimes it's a question of not quite getting it and putting an incorrect label or an incorrect comment. So that is something that has to be addressed. The major contributors were out of a class of, let's say, 30 students. Not all 30 were represented in the wiki. Some were really gung-ho and put in 80 or 90% of the slides. Others were just sort of watching from the sidelines. So from a professorial perspective, you might want to involve more of the students. And certainly need to organize in regards to who does what and everything we said before and all of these features to make it work. Now, where's all this heading? That refers to these first two projects, namely having the students use these skills and learn these skills. What is it all for? I mean, obviously, the first thing is understanding pathology. You have a lecture course, you learn about all the pathologies. Now you have a lab course where you'll find it, you look at it. But I think there's more to it than that, what I'm calling preparation for the coming world of digital pathology. We're going to look at this in three aspects. First of all, application of skills in slide analysis, to be able to do the things that I spoke about, to look at a slide to find the area of pathology and analyze it. Now, for those who are going to go on to a career in pathology, become pathologists, so this is the beginning at the undergraduate level of a lifelong craft, learning a skill. But what about everybody else in the class? Those are going to be, shall I say, plain old doctors, even if they're not, plain old, they're skilled gastroenterologists and pulmonologists and so on, but not pathologists per se. Where does this fit in for them? I'm going to suggest several answers to this question. First of all, and very interestingly, more and more you are finding digital images in online journals. Kegel and Glassy wrote about this in an article surveying the field. Here's an example of a journal article. And in this journal article, you have a link. Now, if I would click on this link right now, and I'm not going to because I don't want to get out of Zoom and PowerPoint and possible complications. But if I would click on this link, and you can see it here, I have some individual shots. You go to the slide, and you can zoom in, and you can zoom in. In other words, you are out of the journal, so to speak. You are into a location. You have access to not a picture, not a fixed image. So here's the pathology, but you have the slide itself. So you, the viewer, the physician reading the article, can see the slide, can look at it at different levels, all the way from the whole totality of the slide down to the nuclear level, and make your determination for whatever reason as a professional you would wish to look at that. And you have that capability based on the skills that you learned in the lab, such as I'm describing, to show you how to do all of these things. In a similar vein, that was A, this is B, part of section 1. More and more, there are digital images and pathologist reports. All right, so classically, old days, you get a pathologist report, you get a written description. I see collection of cells, hyperchromatic nuclei, mitotic figures, subcutaneous, etc., describing what he saw. This was followed by a period of time where you get, even to today, a picture, an image. Pathologist reports back to the physician what he saw. But now, many of them are coming to a link to a digital image. So you click on the online pathologist report, you are transported in the way we have been describing to an image, and now it's a digital image, and you can zoom in and zoom out and go right, left, up, and down. And if you are so inclined and so trained, you can make your own judgment, or at least have something to discuss with the pathologist as to what you observe. So that was the first part, analyzing slides. The second skill that you learn in the undergraduate level that you'll be using as a professional relates to the whole question of archiving and retrieval. Right? It used to be that you had stacks and drawers of glass slides, perhaps hundreds of thousands of them. Danger of breakage and damage, danger of misfiling. Now it's all being digitized. Now it's all being made accessible to servers all over the world. And my point is, this kind of a wiki trains the undergraduates for this coming world of digital archiving and retrieval. And thirdly, as I anticipated, and as they did with this wiki, you have training in the world of telepathology. Telepathology means the physician at his desk can consult with the pathology lab. They can both look at the same slide. They can discuss it if need be. Or more likely and more professionally relevant, you can take a digital image in some area of the world where there are not too many highly skilled pathologists, send it digitally over to the Mayo Clinic, or some major institute in the world, anywhere, and get a second opinion. And the use of the wiki is sort of foreshadowing that concept and getting them used to the idea of capturing images and sharing them and discussing them. The third project is a virtual pathology lab. Now, the background to this is what's called a virtual patient, and this has been around for a while. The website is constructed where you have a scenario, a story written. The patient comes in with certain complaints, and you go through clicking on various choices. You can get physical examination information, you can get radiology information, you can get chem lab information, microbiology lab information, you can get a whole range of testing, and you call for this and you call for that, and you build up your diagnosis and so on. So I wanted to create a website primarily geared for pathology residents, but for anybody, to review digital slides. And I created such a website. It's called Review and Exercises in Digital Pathology. Here is the link. And the point that will overlay everything in this case and then all the others is that it costs basically nothing, and you get a tremendous amount of usable product. There were two external sources that were critical for this. One is called Twine. Here is a link. It's a commercial organization. And Twine involves special programming. involves CSS, JavaScript. It's bottom line, not all that difficult to learn. So you learn if you to do this, you do this, you do this, you do that. If anybody has any experience minimally in programming, it's certain things to do as input to give you a certain output. So now you create a page. So this is in Twine, and this is my text introducing the website. Number of subject areas. Note this is in color. Note that this is in double brackets. The double brackets indicates that if you click here, you go to some other screen. So that's a little bit of Twine programming, and the color indicates that it worked. And when you do that times many such individual screens, you put together a storyboard and you draw these arrows into what goes to what. From this one, you can go here, or you can go here, or you can go here. And then if you go here, this one goes to this one, and this screen goes to this screen, and this screen goes to this screen, and so on. This screen goes back up to here. All right, so you have control over the flow of the story. You have control over the presentation of the material, as complex as you wish. Then with one click, you have a build command which converts Twine coding to HTML, which is the language that the web understands. The second partner, so to speak, second other commercial product that I utilize is called NeoCities. NeoCities takes HTML and puts it online for the world to see. So you generate the HTLC, that's where Twine came in, everything we just said. Now upload to a new file up to NeoCities. I have a previously created site with them, zleiferneocities.org. And when you do that, this is what results. All right, now it's not too easily readable, but what you just saw is exactly this. This is what I created, and this is what shows up on the site for the world to see. I'm going to show you two examples of what you can do with this. Here you click on tumor board cases. All right. This is the story. You can enjoy yourself. It's called, Can You Find the Mucin That's Loose in the Tumor? And as Dr. Chan was holding forth at the weekly tumor board meeting, you don't have to read this all, but it's essentially a story. Tumor board meeting, professor, students. Here the question is diagnosis of lung cancer, lung tumor. The question is it large cell tumor or is it adenocarcinoma? They're using mucin staining with the understanding that mucin, which stains for mucin, is negative in large cell carcinoma and positive mucin in adenocarcinoma. The question is, can you find the stained region or determine that none is present? And now everything we've been talking about comes into play because you have one word. The word on the screen may say slide 12 or whatever, but it relates to a link, URL, and the link takes you to a virtual slide, just as if the professor handed you a slide and said, here, take a look at this. And this is, here's your mucin staining. If it's a demo slide, it is clear like this. If it's an unknown slide, you have to hunt and find it, but that's the whole point. All right, you have an unknown slide, and it's a virtual slide. I keep saying this. Zoom in, zoom out, pan right, pan left, up, down. Search the whole slide. Find the region that has the stain, or look at every possible corner to determine that it doesn't have the stain. And then you go through the story. In this particular story, one resident says, I use TTF1, which is a different stain, thyroid transcription factor 1. He says also stains for adenocarcinoma. Professor says, show me. He shows him sample case. Again, one click, virtual slide. Here it's pretty clearly mostly stained, but not always. This is in the context of the story, the student stained the slide. He's making his argument. Professor says, yeah, but there's a paper that shows that TTF really doesn't differentiate. It's not really usable. So the discussion goes back and forth within the context of my website. Professor supports his point, and my website has a link to the paper that was cited. And you can go in, you can read exactly what they did and how they did it and so on. What emerges from this, now me to you, didactically, there are a number of things that come out of this. First of all, educationally, didactically, discussion of large cell carcinoma versus adenocarcinoma, everything that needs to be said about that. Secondly, discussion of differential staining, UCGConferences versus TTF, strengths and weaknesses, and so on. In particular, in this story, weakness of TTF to differentiate. They make a scientific point. In addition, you have what I'll call a teaching point. As the professor says, keep up with the literature. Student missed up on something, he didn't read the relevant paper, and he wasn't prepared for the discussion. Now, this is the same page you saw before. I'm pointing your attention down here to this other option that you have. It's called Where's Patho? Here is a screen you saw before. Here is what it looks like when you come to the screen. Where's Patho? What in the world am I talking about? Where's Patho? By way of introduction, there is I'm going to call it a children's book, but not necessarily for children. It's called Where's Waldo? That's in America and Europe and other places. It's known as Where's Wally, same idea. So here is Waldo. Okay, nice guy. Take note, striped shirt, blue pants, cute little hat, interesting glasses, unique hairstyle. Okay, that's Waldo. When you get to the page in the book, what you see is this. Where's Waldo? Somewhere in here, in this very crowded page with lots and lots of people and so on, our friend Waldo is in there. But you have to look very, very carefully. Not only do you have things that are clearly not, but you have things that are very close to it. Different shirt, different hat, different pants, and so on. So you have to really know what you're looking for and find it. Using that as an analogy, and this is what my website will accomplish. A couple of examples. Here is a Reed-Sternberg cell, characteristic of Hodgkin's disease. Large cell, larger than these. Double nuclei, prominent nucleoli. You can spot it. But now for the real pathologist, this is what Hodgkin's disease looks like. You have to find that Reed-Sternberg cell somewhere in here amongst all of these other cells that are not. Following up on this, you have a Langhans giant cell in tuberculosis. Again, a multinuclear giant cell, nuclei characteristically arranged in a semicircle around the periphery. But now you have to find that amongst this, and probably in this area, and know what you're looking for, scan the whole slide, try to find it. Different challenge. Here's a condition known as a giant cell tumor of the tendon sheath, characterized by multinuclear giant cell. Here is your giant cell. Here are your multiple nuclei. But now you have to find that within this real life slide that you're going to be challenged with. And finally, you have condition of rhabdomyosarcoma, skeletal muscle tumor. Characteristic features what's called a brick red tumor cell. This is not a single cell, not multinucleate, one nucleus, but characterized by this pinkish staining, large amounts of cytoplasm. Right? You can recognize it. But now can you find it here? This is a real slide. This is what the pathologist has to look at. And that's more challenging. So my point is, you have access through the website to digital slides, up, down, right, left, zoom in, zoom out, find your pathology and analyze it. Good for training. You can access these slides. For my purposes, I want one-click access. With any site that may have a great slide, but any site that involves a password or multiple steps to get to is not my purposes useful. And there are links. There are things, and as we said, in journals. There are publicly available collection. Digital Pathology Association has a number of them listed, and various institutions and organizations, universities have archived slides that are available by link. The point I wish to make is that it's quick and easy. You don't need an IT or staff. You don't need an IT person. Also, as I said, a little bit of programming, but fairly easy. You don't have to store your slides at your institution. You don't have to have an investment in hardware and software. It's all publicly available. It's all free. And as you can see, it's very powerful. You can add, you can modify, update, expand. You have complete control over your content, which is to say, material for the undergraduate level, material for residents, material for professionals. Make your cases and your stories as complex as need be. It's easy to upload, modify the storyboard. The use of a story, you may say is background is trivial, but it provides interest, provides motivation, and allows you to make these various didactic points, whether with regards to science or regards to slide analysis. So there's a lot of professionally important capabilities here. As I said, for medical students, for residents, for pathologists, for tumor board practice. The main goal is slide identification. Point being not just what is it, but rather, can you find the region of interest? Tell the students, and they see clearly that much of the slide is normal. Your job is to know the difference between normal and abnormal. Plus, there are other complications in the real world, like artifacts, slide tissue folded over, and then cracks in the slide, and so on. So you have to, if you're going to do serious analysis of a slide, you have to work with a digital slide compared to an idealized text or atlas picture. So in summary, meaning of these first 3 points. The world is moving towards digital pathology, and the ideas suggested up till now are ways in which future pathologists and clinicians can be trained at the medical school level in the concepts and techniques that will be part of the digital world that will be their future. Now I want to turn to some other ideas, not digital pathology per se, but yes, pathology. And once again, the theme is doing it with hardly any expense. Calling this 3D printing in quotes. The challenge is that the biopsy is 3-dimensional, the slide is 2-dimensional. The challenge is how to make a 3-dimensional representation of a tissue sample. That's important because there are a number of critical issues. Ideally, normal tissue should be seen at the edge of the slide. So you have a slide in front of you, looks good. But what about in front and in back of that slice? So it's a 3-dimensional object, and it may be to the end of the slide, which means you didn't get it all out, which means you have to cut more or observe more. Similar argument, various, let's say, melanomas. Depth of penetration is important and relevant. You may have deep penetration to the subcutaneous tissue, which means possibility of metastasis. You may not find it in the slide that you have in front of you, but what about in front and in back of the slide, and so on. And the overall shape of the pathology, where is it in its environment? And the question is, how do you give over these concepts to students? The goal is 3D printing, solid. Now, we know 3D printing, and you have basically layers of plastic, and you get a solid object. You can even use it, in this kind of what I'll call simplistic sense. It's clever and it makes a point for the paper, but limited in colors and limited in structural detail. There was a hint from a work by MCOR company. They used paper instead of plastic. You got photographic detail. They took multiple pages, layered them, glued them, produced a solid object in this way, and then trimmed away the excess. Here is one kind of thing that they did, right? So you couldn't, compared to this, you couldn't get this many colors with the old single color plastic. But now you got a photographic capability. This is raised, this is 3-dimensional, and that's fine, but you can see what's inside this hill. For the right price, you can do it. This is Darren Trainer's work. 1-micron slices, hundreds of them. Each pixel captured, put it together in this fashion, and if I would click on this, you could go in this direction, front to back, or you can go in this direction, right to left, or you can go in this direction, just shaving off surface layers, top to bottom. So you have a tremendous amount of capability, and tremendous expense, and tremendous amount of know-how, and tremendous amount of, and for the right price, as I say, you get a lot more, but not necessary for the undergraduate level. I took the low budget route, worked with Dr. McLean, took keratoacanthoma, which is a lookalike for squamous cell carcinoma, and therefore important to know about. So briefly, here is the biopsy. Here we sliced it up. He did all the proper preparation of slides from each of those slices, 40 in all, sent me 2 to a page, which I then printed out, and then took my scissor literally and cut around. Call this an invention, whatever you want to call it. I asked my engineering people to prepare a wooden board, and we made slits in it. So now, starting with this, no idea what's in here. Final product looks like this. Right here are this is not copy paper, but a little firmer. Has to be flexible enough to go through a copying machine, but firm enough to stand up like this. So you get the shape of the tumor. You can pick out any one of these. Note that this is a real slide. You have all the details, all the colors, all the shading of a real slide. You want to see if it goes to the edge. You want to see if it goes down to subcutaneous tissue. You can take a look at it here, and as I suggested, see what's in front of it, see what's behind it, see all of these slides to see whether your particular section is representative. So at the very least, you have a model to show to students and to residents. You have a teaching device. Margins to the base and to the sides. You can use it to study structures that come in, like blood vessel formation, not in the front, not in the back, but in this particular region. You can study the environment as it may affect the tumor. From a clinical point of view, you have a model to show patients, right? You see, Mr. Jones, this is your tumor, and this is why it has to come out. It becomes a dramatic form of presentation. And all of that clearly is different from a static image in a text or an atlas. Finally, Project 5, commercial product called the Foldscope. The Foldscope is a paper microscope. Now, this is developed by Dr. Manu Prakash, Stanford, heavy-duty scientist, serious person. He developed this and sent it out by the thousands to generate an interest in microscopy. That's just an aside. But the Foldscope is made of paper. Again, a little firmer than the usual paper, but not too stiff as cardboard goes. It's folded like origami. Costs about $1 compared to an $800 or $1,000 microscope, but it really works. You have magnification up to 2,000 power. It's easy to transport. It's, I don't want to say indestructible, but you can drop it and not worry about it. You can step on it. Try dropping a $1,000 microscope and then you have problems. We developed a project to test the Foldscope for use in urinalysis. 2 students were involved in this, Rebecca Calder and Daniel Stevens, both certified lab technicians in their other lives, experienced in analyzing urine samples. We use water samples of uric acid and calcium oxalate, as would be found in real urine pathology. Primary goal was to test the microscope, and we did that rather than use patient samples so as not to need institutional review board approval and HIPAA, which is privacy issues, patient samples, and so on. So here is a Foldscope, comes in the mail if you wish. These are all the pieces. You push them out, as you might imagine. Here are the instructions. Fold here, twist this, etc. Put this here. Put it all together. This is what it looks like from the top. This is what it looks like from the bottom. And it really works. We tested it out preliminarily with a genuine pathology slide, glass slide. In this case, healed going tubercle at low power and at high power. And you can really use it for that imaging. So now the question is, can we use it for analysis of crystals in solution? So here is calcium oxalate in the regular microscope, $1,000 microscope. Here is calcium oxalate in the Foldscope. Same appearance. You have, if you know your crystal and you have certain amount of training and experience, you can use this to make that comparison, and it compares well. Here's uric acid, different appearance, different kinds of crystals seen in the microscope. Here it is seen in the Foldscope. Again, characteristic appearance. Bottom line, it works. $1,000 scope, $1 scope. From a research point of view, we would like to do more crystals, a whole series, a dozen or more, for different urinary tract pathologies. Use real samples instead of water samples. So there's work to be done just at the technical level, but you see where this is going, and you see that the fold scope can be used. There are some issues that are involved. For urine samples, holding the fold scope up to the light may result in the sample dripping onto your face. Not great. Besides the yuck factor, there may be a danger of infection, so there are things to be considered, and therefore there's a need to clamp it to a surface, work flat, not tilted up to the light, develop adequate lighting sources, therefore, and develop just a literal nitty-gritty of where to put your photographing methods. But ultimately, the goal is to photograph it. You can do it with a cell phone, you can do it with an iPad mini, which in turn leads to telepathology from the field to a suitable diagnostic lab, depending on your circumstances. Having said that, this is one scenario. You can have an endless number of scenarios. A nurse on a truck travels out to the field, which is a local village, whatever your country, whatever your region. Could be out in the desert, could be in the jungle, could be in some other, where there's some kind of a clinic, let's say, but not a major medical center, which is the point. But you want to do the best medicine that you can. It's hard to carry multiple expensive heavy microscopes with the fold scope in the jacket pocket, or a box full for the local infirmary, or even to train the local residents, meaning people who live there, trained enough to recognize a crystal and photograph it and send it on, so you have the capability of diagnosis at a distance. Bottom line, from everything that I have said this morning, I encourage you to use your imagination, to be creative, to think cheap. There are ways to save money and not lose didactic capabilities. You can adapt freely available software and methods for use in pathology education, in medicine, and in research. And while you're doing this, have fun, enjoy. Creativity is pleasurable, and go for it. Anybody wants to have any further discussions, kindly contact me, zleifer@limdp.org. I thank you, one and all.
Thank you, Dr. Leifer, for this beautiful and very comprehensive presentation with very creative solution to solve some problems in pathology, especially when there's almost no budget. I think we all need this because pathology has to be transferred into all regions, and it's very difficult to do this with a very low amount of money. So thank you very much for this very beautiful presentation.
Welcome.
Are there any questions or comments from the audience? Well, I got a question. Is it possible to get this this foldable scope somewhere?
Absolutely, it's commercially available. I don't
Okay.
have you go to Google and put in fold scope. You'll get any number of links. You can get.
Okay.
It has, from its original conception, it has grown to be a worldwide operation. It's been commercialized as a whole offshoot, and now you can get bulk orders for classrooms. You can get not a problem. It's just plug in fold scope and follow the links.
Okay. Well, thank you very much. So I take a look at the comments. So there are a lot of thankful remarks, and I'm just searching if there are any more detailed comments there. Yeah, well, so a lot of thanks to you from the whole participants. And,
Hello?
and I'm,
Am I audible?
yes, you are. You got a question, Dr. Kinshore?
Not a question. It's a comment about Dr. Leifer's talk about this photoscope thing. I have one in India right now with me on my hand, like in like next room. It's actually very quite effective and useful. I've seen as an experimentation. I bought one, and it is almost $1 or something USD, and it's available in India too. Yeah, that's the only thing I would like to add upon Dr. Leifer's lecture. Thank you.
Okay, I think if there are further comments and further remarks,